Right, you're dispatched to Weber State University for a 22-year-old male fall victim.
Okay. BSI is my scene safe.
It is.
Okay. MOI is a fall. I have one patient. I'm going to call ALS, and sir, can I have you hold C-spine for me? I want you to hold his head just like this, just in line.
Okay.
Okay. Thank you. And sir, can you hear me? Sir, I'm going to try pain stimulus here. I get a moan. Do I hear any breathing?
No.
I'm going to open up his airway. Okay, he takes a breath.
What happened?
Sir, you fell. My name's Frank. I'm with Weber EMS. Is it okay if I help you?
Yeah.
Okay. He's talking to me now. I'm going to open up his airway and look into it. Sir, can you open up your... Do you feel around your mouth? Do you feel anything blocking your airway there?
No.
Okay. I'm going to put him on 15 liters per minute, non-rebreather. And I'm going to check his breathing now. Sir, take a deep breath for me. Okay, and out. Is that nice and easy?
Mm-hmm.
Okay. And now I'm going to check circulation. I'm going to feel a pulse. I feel a pulse. Strong and regular. His skin is pink, warm, and dry. And good cap refill. Looking over my patient, do I see any pools of blood?
On his right lower leg.
Okay. I'm going to do a quick assessment. Sorry. Tell me if I find any bleeding. Checking down his arms. Felt the pulse there. Checking down his arm here. And he has a pulse. Checking down the thorax. Do I find any bleeding?
No.
Okay. Feeling the ribs. Quadrants, the pelvis. Feeling down his left leg. Any bleeding?
No.
Okay, and down his right.
Blood found?
Okay, I'm going to cut and expose, and I see a bleed. Is it venous or arterial?
Venous?
Okay. I'm going to put direct pressure, and before I bandage it, I'm going to check PMS. I feel a pulse. Sir, can you push down on my hand for me? Okay, and pull up. Do you feel what I'm doing?
Mm-hmm.
What am I doing?
Squeezing my toe.
Okay. Now with that, because it's a venous bleed, I'm going to do a spiral wrap. I've checked PMS before. Rolling on. Sir, do you have any allergies?
No.
Are you on any medications right now?
Mm-mm.
How about any medical history?
No, I'm pretty good.
Never passed out before or anything like that?
No.
Okay. When's the last time you ate?
Breakfast.
Breakfast? Okay. How long ago was that?
3 hours ago, 4 hours ago.
Okay.
I don't know.
And what were you doing before you fell?
I was working on something on the ceiling.
Something on the ceiling? Okay. So it's about 4 foot fall. Okay. We are going to transport the patient now. Let me get some vitals. Heart rate of 64. And 14 respirations per minute. I'm going to get a quick blood pressure on my patient. So you're working on the ceiling?
Yeah.
Okay. Sir, did you see what happened?
I just saw him laying here on the floor and tried to wake him up, and he wouldn't wake up, so I got really scared and called 911.
Okay. Well, thanks for doing that. Okay. I've obliterated the pulse. Blood pressure is 116/80. I'm gonna listen to lung sounds. Sir, take a deep breath for me. Okay. One more. And one more. Okay, lung sounds are clear and equal bilaterally. I'm gonna check pupils. Sir, look at my nose for me. Okay, pupils are pearl. Check the nose and ears for CSF while I'm here. Okay, I've checked the neck for step-offs and JVD, deviated trachea. The trachea is midline. I'm going to put on a C-collar and transport my patient. Okay. There's that. Okay, this is to remind you not to move your head, okay? All right, now we're going to check his back. Bystander, on your count, we're going to roll him towards me.
1, 2, 3.
Okay. Now I'm going to cut and expose and feel down the spine, checking for any step-offs or any pain. Let me know if you feel any pain here, okay? And do I see any decap ETLS problems? Okay. And I'm feeling the rigidness of the ribs in the back here. Are they intact?
Yes.
Okay. Pulling the backboard. Bystander, on your count, we're going to roll him back down.
1, 2, 3.
Okay. All right, and up towards you on 3. 1, 2, 3. Okay. All right, now I'm going to spider strap my patient. I'm going to secure at the chest, at the pelvis, above and below the knees, and then I'm going to secure the head.
Consider it done.
Copy. Okay, we are now in transport. And I am going to now, oh, you can go ahead and let go of C-spine. Have him on a head bed. Thank you. I'm now going to do a detailed physical exam. Sir, you let me know if you feel any pain, okay?
Mm-hmm.
Okay, I'm feeling the scalp, cranial bones, they're intact. Checking the orbits, on the nose, mandible and the maxilla. I've already checked inside the mouth, and I've checked the neck for decap, BTLS, JVD, deviated trachea. Checking the shoulders and the collarbones, long bones. And while I'm doing this, I'm cutting and exposing as I go. Checking the sternum. Take a deep breath in for me. Okay, and out. Okay, ribs are intact. I'm going to check the 4 quadrants. Tell me if you feel any pain, okay? Rebound tenderness. Okay. I'm going to check PMS in the arms. Squeeze my hands for me. Okay, squeezes are equal. I have bilateral pulses. Can you tell me what I'm doing?
Rubbing my thumb.
Which thumb?
Left.
And what am I doing now?
Rubbing my finger. Index finger.
Okay. All right, I've checked the pelvis. I do not feel the need to check the genitalia at this time. Now checking long bones. Cut and exposing. Checking for decap ETLS. For the short bone, I'm going to check the integrity of this bandage. Be sure that it's not bleeding through, anything like that. I'm going to check bilateral pulses on the feet. I feel pulses. Sir, can you push down against my hands for me and pull up? Okay. Do you feel what I'm doing to you?
Yeah, squeezing my toes.
Okay. All right. I'm now going to call the hospital, let them know what I have, and I'm going to do an ongoing assessment. And I'm going to reassess vitals. So,
Vitals at this time, our pulse is 110, respirations are at 20, BP is at 100 over palp.
okay, my patient is going into shock. I'm going to put on a blanket, keep him warm. I'm going to elevate his legs and be sure that he has his oxygen on. That work? Okay. And I'm going to continually reassess vitals. I'm going to call the hospital. I'm going to call McKay because they're right here. McKay, this is Weber State Ambulance 1. How do you copy?
Go ahead.
Okay. I have one patient. He has taken about a 5-foot fall. He has a laceration to his right lower leg. Bleeding is secured. Patient has gone into shock. I have taken shock precautions, and we are 5 minutes out. Any orders?
Not this time, we'll see you in 5.
Copy.